Let's discuss some MCQs from cardiovascular system. Each MCQ will be followed by its options, and after I read these options, I will give a pause for about 5 to 10 seconds, during which you can think. Most likely, this time will not be good enough for you. So, you can pause your mobile phone or your computer so that you can think more and then you can answer the question. But for the sake of teaching, after reading each MCQ, I will give only 5 to 10 seconds to think and answer the question. Very first question is, blood returning from the systemic circulation enters the heart through the pulmonary veins, inferior vena cava, aorta, pulmonary artery, coronary sinus. The answer is inferior vena cava. So systemic circulation starts from the left ventricle and takes blood out of the heart along the aorta, and the blood returns back to the right atrium along the superior and inferior vena cava, while the pulmonary circulation starts from the right ventricle and blood goes to lungs along the pulmonary arteries and blood comes back to the left atrium. Next question is, which structure carries deoxygenated blood from the heart to the lungs? It's a very simple question. Options are aorta, coronary artery, bronchial artery, pulmonary vein. And the answer is pulmonary artery. It is the pulmonary artery that carries deoxygenated blood to the lungs, and after blood is oxygenated in the lungs, that returns back to the left atrium along the pulmonary veins. So answer is D, pulmonary artery. Next question is, systemic circulation has dash, while pulmonary circulation has dash. Options are A, low pressure, high pressure, B, high pressure, low pressure, C, lower resistance, high resistance, D, less oxygenated blood, more oxygenated blood, E, smaller vessels, larger vessels. And the answer is systemic circulation has higher pressure while pulmonary circulation has lower pressure. So B is the answer. So systemic circulation has got high pressure and also high resistance as compared to pulmonary circulation. Which of the following blood vessels behaves as pressure reservoir due to its elastic properties? Options are heart, aorta, arterioles, capillaries, venules, and veins. So the answer is aorta. Aorta, because it's an elastic artery, it has got a lot of elastic fibers in its wall, so it behaves as a pressure reservoir, which means that it absorbs the pressure which is generated by the pumping force of the left ventricle, so it does not allow the systolic pressure to go up to very high value, and this is because of its elastic properties. This is why aorta is also called as an elastic vessel, or this is pressure reservoir. Next question is, which blood vessels regulate blood flow into the capillary beds of the tissues? Options are veins, capillaries, arterioles, venules, and arteries. So these vessels which regulate blood flow into the capillary beds of tissues, these are the vessels which are also called as resistance vessels, and these are arterioles. So by changing their diameter, by their constriction and dilation, they can control the volume of blood that's flowing through the blood vessels or capillaries in the tissues. Which blood vessels act as capacitance vessels holding most of the blood volume? Options are arterioles, veins, capillaries, arteries, met arterioles. And the answer is veins. So veins, they are also called as capacitance vessels or compliance vessels because veins are the blood reservoirs. They store about two-thirds of the total blood volume of our body. This is because the caliber or the diameter of the veins is larger than that of arteries, and also veins can be easily expanded because they have got less smooth muscles in their walls. Next question: venous return would be increased by dilation of veins, loss of venous valves, increased skeletal muscle activity, decrease in respiratory rate, and decrease sympathetic activity. And the answer is increased skeletal muscle activity. So the factors that increase venous return are presence of the venous valves and also the contraction of skeletal muscles around the veins, increase respiratory rate, and increase sympathetic activity. Next question is which type of capillary is most common in the human body? And the options are fenestrated capillary, sinusoidal capillary, continuous capillary, arterioles, and venules. And the answer is most common capillary in human body is continuous capillary. Continuous capillaries are present in our brain, skin, connective tissue, muscles. These are least permeable as compared to other types of capillaries, and they are most common in our body. Next question: which type of capillary is found in liver, spleen, and bone marrow? Options are continuous capillary, sinusoidal capillary, fenestrated capillary, arterial, and lymphatic capillary. And the answer is sinusoidal capillary or sinusoids. So sinusoids, they are present in liver, spleen, and bone marrow. Another question which you may be asking in your examination is which type of capillary is present in our kidneys? And the answer is fenestrated capillary. In kidneys and intestine, fenestrated type of capillary is located. Next question: which of the following is a major force that drives fluid out of capillaries? Capillary hydrostatic pressure, B. Interstitial hydrostatic pressure, C. Capillary oncotic pressure, D. Interstitial oncotic pressure. So the answer is capillary hydrostatic pressure. So capillary hydrostatic pressure, this is the same force which is also called as blood hydrostatic pressure. This is 35 millimeter of mercury at the arterial end of capillary. As you can see here, this is an outward force. And this is the major force which favors filtration at the arterial end of capillary. Next question is capillary oncotic pressure is primarily due to options are sodium ions, plasma proteins, glucose, water, lipids. And the answer is plasma proteins. So capillary oncotic pressure, which is also called as blood colloidal osmotic pressure, its value is 26 millimeter of mercury. This is because of plasma proteins, especially albumin and globulin. If you ask this question in examination, which plasma protein is most important in exerting the oncotic pressure or plasma colloidal osmotic pressure, the answer will be albumin protein. Next question is which factor contributes to excessive accumulation of interstitial fluid or edema? Options are increased plasma protein concentration, B. Decreased capillary oncotic pressure, C. Decreased capillary hydrostatic pressure, D. Increased lymphatic drainage, E. Decreased permeability of the capillary walls. And the answer is decreased capillary oncotic pressure. So there are four important factors which can cause edema. Number one, if the blood hydrostatic pressure is very high. Number two, if the inward force or the blood clot osmotic pressure is low. Third factor is if the permeability of the capillary wall is increased, and the fourth factor is if the lymphatic vessels are blocked. So if any of these four factors is affected, this will lead to accumulation of fluid in the interstitial spaces, which is called as edema. Next question is the lymphatic system helps in the absorption of fats in small intestine through options are blood capillaries, lacteals, lymph nodes, spleen, thymus. And the answer is lacteals. So lacteals is the name for lymphatic capillaries which are present in the villi of small intestines. These are responsible for absorbing large molecules of fats. Please mind it that the digestion products of carbohydrates and proteins are absorbed by the blood capillaries because they are small in size. But the digestion products of most of the fats, they are large molecules, so they are not absorbed by blood capillaries. Rather, they are absorbed by lymphatic capillaries, which we call as lacteals. Next question is according to Ohm's law, which of the following best describes the relationship between blood pressure, blood flow, and resistance? And the options are Blood pressure is equal to blood flow into resistance. Blood flow is equal to blood pressure into resistance. C. Blood flow is equal to blood pressure divided by resistance. D. Resistance is equal to blood flow divided by blood pressure. E. Blood pressure is equal to resistance divided by blood flow. And the answer is C. Blood flow is equal to blood pressure divided by resistance. So this is the formula of Ohm's law, which means that blood flow will increase if blood pressure will increase. And also, if the resistance decreases, blood flow will increase. So it means blood flow has direct relationship with the blood pressure, and blood flow has inverse relationship with the resistance. The same Ohm's law can also be written as that blood pressure is equal to blood flow into resistance. So it will be the same equation. So blood pressure will remain here, and the resistance from denominator, when it will go to the other side, it will become a multiplication factor. So blood pressure is equal to blood flow into resistance, or you can write it as blood pressure is equal to cardiac output into resistance. Please mind it that this is one of the most important formulae in physiology, which every student must learn. Blood pressure is equal to cardiac output into resistance. This is according to Ohm's law. Next question is, Ahmed has 120 by 80 millimeter of mercury arterial blood pressure. What is his mean arterial blood pressure? And the options are 90, 93, 98, 100, 105 millimeter of mercury. And the answer is B, 93 millimeter of mercury. So how do we calculate mean arterial blood pressure? The formula for this is diastolic blood pressure plus one third of pulse pressure. Diastolic pressure in this case was 80 millimeter of mercury. And what is pulse pressure is the difference between systolic and diastolic, which is 40 in this case. So one third of 40 is 13.3. 80 plus 13.3 will be 93.3 millimeter of mercury, which is close to 93. So B is the option. So you must know the formula for calculating mean arterial blood pressure, which is equal to diastolic pressure plus one third of pulse pressure. Next question is, if a person's blood pressure is 110 by 70, then the pulse pressure is 40, diastolic pressure is 40, systolic is 70, mean arterial pressure is 120, systolic pressure is 180. So the answer is 40. Pulse pressure, yes, which is the difference between 110 by 70. So the difference between these two will be 40 millimeter of mercury. That's the pulse pressure. Diastolic pressure is 40. This is wrong because diastolic is 70 here. Systolic is 70. No. Systolic is 110 millimeter of mercury. Mean arterial pressure 110. No. Mean will be somewhere in between 110 and 70. And systolic pressure is 180. Rather, systolic is 110 millimeter of mercury. Next question is, which of the following decreases vascular resistance? And the options are vasodilation, increased blood viscosity, longer blood vessel length, increased hematocrit, and last option is arteriosclerosis. The answer is vasodilation. Because vasodilation means the diameter or the radius of the blood vessel will be increased. More is the radius, less will be resistance. All other factors, they can increase the resistance. The resistance is inversely proportional to the fourth power of the radius. So when we increase radius, the resistance will be decreased. Next question, which of the following is a vasodilator that helps to lower blood pressure? The options are angiotensin 2, nitric oxide, aldosterone, vasopressin, and last option is epinephrine. And the answer is a vasodilator that lowers blood pressure is nitric oxide. Nitric oxide is a very important vasodilator that's produced from the healthy endothelium. Nitric oxide is also called as endothelium-derived relaxing factor. There are many other vasodilators in our body, some of which are histamine, bradykinin, potassium ions, hydrogen ions. Next question is, if a vessel were to dilate to twice its previous radius and if pressure remained constant, blood flow through this vessel would, and the options are increased by a factor of 16, B increased by a factor of 4, C increased by a factor of 2, D decreased by a factor of 2, E decreased by a factor of 8. And the answer is increased by a factor of 16. So this is calculated according to fourth power law or the Poiseuille's law. According to fourth power law, resistance is inversely proportional to the fourth power of the radius. So if the vessel is dilated, so according to fourth power law, if the radius is doubled, so 2 raised to power 4, which means 2 times 2 times 2 times 2, which means the resistance will be decreased by 16 times. If the resistance will be decreased by 16 times, then the blood flow will also be increased by 16 times. So this is why in this case there will be an increase in blood flow by 16 times. Next question is Poiseuille's law states that the blood flow is most affected by, and the options are blood vessel length, B viscosity, C radius, D heart rate, E stroke volume. And the answer is vessel radius. There are three important factors that affect vascular resistance, and these are radius, length, and viscosity. The most important factor is the radius of the vessel, which is having inverse relationship with the resistance according to fourth power law. So this is the most important factor. So if the radius is doubled, resistance will be decreased by 16 times. If the radius becomes 3 times, then its resting value, then the resistance will be decreased by 81 times. So this is the most important factor that has tremendous effect on the resistance and the blood flow. Next question is which part of brain regulates blood pressure through the autonomic nervous system? And the options are medulla oblongata, cerebellum, hypothalamus, pituitary gland, and last option is thalamus. Answer is medulla oblongata. So cardiovascular center or vasomotor center is located in our medulla and bones of brain, and this center is responsible for controlling our blood pressure by controlling the blood vessels and the heart. Next question is primary short-term mechanism for regulating blood pressure is options are renal regulation, B baroreceptor reflex, C hormonal regulation, D blood volume changes, E temperature regulation. And the answer is baroreceptor reflex. There are two types of mechanisms that control your blood pressure, short-term and the long-term mechanisms. Among the short-term mechanisms, most important mechanism which works minute to minute to control our blood pressure is baroreceptor reflex. There are two important nerves which work in this reflex system to buffer the changes in blood pressure, and they are glossopharyngeal nerve, nerve number 9, and the vagus nerve, cranial nerve number 10. And these two nerves are also called as pressure buffer nerves. Chemoreceptor that help regulate blood pressure are sensitive to changes in blood pressure, oxygen, carbon dioxide, and pH levels, blood volume, blood viscosity, and last option is heart rate. And answer is chemoreceptors that help to regulate blood pressure. They are sensitive to changes in oxygen, carbon dioxide, and pH level. So when oxygen level becomes low, carbon dioxide is high, and pH is low, which means hydrogen level is also high, then the chemoreceptors which are in the carotid bodies and aortic bodies, they will be stimulated and they regulate our blood pressure. Chemoreceptor reflex, just like baroreceptor reflex, is also a short-term mechanism to control our blood pressure. Some other mechanisms which work on a short-term basis to regulate our blood pressure are central nervous system ischemic response and brain bridge reflex. Next question is which of the following mechanism is not involved in short-term regulation of blood pressure? Baroreceptor reflex, B chemoreceptor reflex, C renin-angiotensin-aldosterone system RAS, D sympathetic nervous system, E parasympathetic nervous system. And the answer is renin-angiotensin-aldosterone system. Why? Because this is responsible for long-term regulation of blood pressure. All other are involved in short-term regulation. So in this system, aldosterone is very important because aldosterone is responsible for sodium and fluid retention to kidneys. And when the blood fluid volume will increase, that will increase our blood pressure. This system works a bit slowly, but it is very important mechanism to control our blood pressure. Next question is foramen ovale allows blood to pass which organ in the fetus? Options are A liver, B lungs, C kidneys, D spleen, E brain. And the answer is lungs. The oxygenated blood which is coming from placenta in the fetus It comes to right atrium, and from right atrium it passes to left atrium, passing through foramen ovale, and it bypasses lungs. Because lungs in the fetus are collapsed, so they're not involved in gas exchange. So there is no advantage of sending blood directly to lungs for oxygenation. So blood which comes back to right atrium goes to left atrium so that the left ventricle can pump it out. Next question is rapid upstroke or depolarization. Phase zero of the ventricular action potential is due to A. Fast sodium influx, B. Slow calcium influx, C. Potassium efflux, D. Increased ATP production, E. Decreased myocardial oxygen consumption. And the answer is fast sodium influx. So if you know the action potential of ventricular muscle, you can easily recall that the phase zero, which is the rapid upstroke or depolarization, this is because of sodium influx to fast sodium channels. The next question is which ion is primarily responsible for plateau phase two of the ventricular action potential? Options are sodium, B calcium, C potassium, D chloride, E magnesium. And the answer is calcium. You can see here in the action potential of the ventricular muscle, calcium is mainly responsible for prolonging the phase 2 or plateau phase. This plateau is the most important phase of the ventricular action potential. And please mind it, this is part of depolarization, not repolarization. And this plateau is responsible for prolonging the refractory period of the ventricular muscle action potential. Next question is the refractory period in ventricular muscle prevents. Options are depolarization, B tetanic contractions, C myocardial relaxation, D calcium influx, E sodium influx. And the answer is tetanic contractions or tetanus or tetanization. It's because when the refractory period is long, that's about 250 to 300 milliseconds in the ventricular muscle. In case of such a long refractory period, the maximum possible total number of excitations in the ventricular muscle are about 3 to 4 per second. And this means the cardiac muscle can contract up to 3 to 4 times per second maximally, and this is not a tetanizing frequency. When a muscle can be excited and then contract at a very fast speed, as is possible in case of skeletal muscle, which has a very low refractory period of 5 to 10 milliseconds, then it can contract for 100 to 200 times per second. And at that fast speed, the skeletal muscle can be tetanized or it can have sustained contraction without relaxation. But this tetanization is not possible in heart. It's because of its long refractory period, which is responsible for prolonging the refractory period or the total action potential duration, hence the total rate at which it can be excited and the rate at which it can contract. Keeping it low, it can prevent tetanization in heart. Next question is what is the main cause of repolarization in phase 3 of the ventricular action potential? And the options are influx of sodium, B influx of calcium, C efflux of potassium, D efflux of chloride, E influx of magnesium. And the answer is efflux of potassium. If you look at the action potential of ventricular muscle, you can see here phase 3 are the repolarization phase, which is also called as final repolarization phase is because of potassium moving out of cell to the potassium channel. So potassium efflux is responsible for causing this phase 3 or final repolarization of the ventricular muscle. Next question is the ability of cardiac muscle cells to generate impulses without neural input is called A. Automaticity, B. Contractility, C. Conductivity, D. Excitability, E. Refractoriness. And the answer is automaticity. So this is the ability of SA node of our heart, which is the normal pacemaker, and that can generate its impulses spontaneously without any external stimulation. Which means that even if we cut the nerves of heart, sympathetic and parasympathetic, even then the SA node can generate its impulses by itself. So this property is called as automaticity. Next question is what is the resting membrane potential of the sinus nodal fibers? And the options are minus 100, minus 90, minus 80, minus 60, minus 20 millivolt. And the answer is resting potential of the SA node is minus 60. But keep in mind this minus 60 resting potential is not a stable resting potential. It's unstable and it moves by itself from minus 60 to minus 40 millivolt. That's because of influx of sodium through the funny sodium channel and influx of calcium through the T type of calcium channels. And this is responsible for bringing the resting limit potential to from minus 60 to minus 40. And this unstable resting potential is also called as pre-potential or pacemaker potential. Please mind it that the resting potential of SA node is less negative as compared to the resting potential of ventricular muscle. In ventricular muscle, the resting potential is minus 90. But here, in case of SA nodal fiber, the resting potential is minus 60. And also, this is unstable that moves by itself from minus 60 to minus 40 millivolt. And this is the reason why SA node is a self-excitable tissue. Next question is SA node is known as the pacemaker of heart because the options are it has highest intrinsic firing rate, B it has the longest action potential, C it has the lowest resting potential, D it requires external stimulation to fire, E it produces the strongest contractions. And the answer is it has the highest intrinsic firing rate. Because the intrinsic firing rate of SA node is 60 to 100 per minute, and that's higher than the intrinsic firing rate of other tissues. Like AV node can generate impulses at a speed of 40 to 60, and Purkinje fiber can generate impulses at a speed of 15 to 40 impulses per minute. The fastest impulse generation in the heart is possible in SA node, which is from 60 to 100 per minute at rest. And because of its highest intrinsic firing rate, our highest rate of generating action potentials, so this is the pacemaker of heart. And please mind it, this is because of this free potential, which is unstable resting potential, which takes its resting potential from minus 60 to minus 40 by itself. And this keeps on happening again and again, 60 to 100 times per minute. So that's why the heart rate will be decided by the activity of the SA node of heart. So that's why this is the pacemaker. Next question is what is the intrinsic signal rate of AV node? The options are 20 to 40 beats per minute, B 40 to 60 beats per minute, C 60 to 100 beats per minute, D 100 to 120 beats per minute, and E is variable. Answer is 40 to 60. I have just mentioned in the previous question that impulse generation is 60 to 100 in SA node, 40 to 60 in AV node, and about 20 to 40 is the rate of generation in the Purkinje fiber. So the second potential pacemaker of heart after SA node is the AV node. Next question is the cardiac conduction system includes all of the following except options are the SA node, B AV node, C the bundle branches, D the chordae and E the Purkinje fibers. The answer is chordae. So chordae they are not part of the cardiac conduction system. All other are part of the cardiac conduction system. Chordae they are small, thin tendons which are attached to the cusp of the AV valves, and they pull the cusp of the AV valve by the contraction of the papillary muscles. Next question is what is the primary receptor type involved in sympathetic stimulation of the heart? And the options are beta 1 adrenergic receptors, B alpha 1 adrenergic receptors, C beta 2 adrenergic receptors, D muscarinic receptors, E nicotinic receptors. And the answer is beta 1 adrenergic receptors. Sympathetic nervous system, which supplies our heart, it has got its neurotransmitter, which is norepinephrine. Norepinephrine acts on two types of receptors, alpha and beta. In our heart, the receptors which are present are of beta 1 type. Next question is the sympathetic stimulation of heart increases. Options are heart rate and contractility, B heart rate but decreases contractility, C cardiac output but decreases stroke volume, D stroke volume but reduces blood pressure, E peripheral resistance only. And the answer is sympathetic stimulation of heart increases heart rate and contractility. Option A. So sympathetic stimulation fuels neurotransmitter norepinephrine open the sodium and calcium channels, because of which the slope of this pre-potential increases. When the slope of pre-potential increases, it becomes more steeper. it will take less time to reach to the threshold value, hence the heart rate will be increased. Next question is what is the effect of parasympathetic stimulation acetylcholine on the nodal action potential? And the options are A. Increase heart rate, B. Decrease the slope of phase 0, C. Decrease the slope of phase 4, D. Increase the slope of phase 4, E. Increases the slope of phase 0. And the answer is parasympathetic stimulation through its neurotransmitter acetylcholine decreases the slope of phase 4. Phase 4 in SA node is actually the unstable resting potential or the pre-potential. So acetylcholine it opens potassium channels and that will decrease the slope. Please mind it. Sympathetic stimulation through its neurotransmitter norepinephrine will increase the slope, make it more steeper, and that's why the heart rate will be increased. But acetylcholine will make it less steeper because that will open another channel, potassium, and making the pre-potential slope less steeper will take more time to reach the threshold, and hence heart rate will be decreased. Next question is parasympathetic nervous system innervates the heart via cranial nerves. A. Cranial nerve number 4. Trochlear nerve. B. Cranial nerve 6. Abducens nerve. C. Cranial nerve 10. Vagus nerve. D. Cranial nerve number 11. Accessory nerve. E. Cranial nerve number 12. Hypoglossal nerve. And the answer is vagus nerve. Parasympathetic system supplies our heart to cranial nerve number 10, which is also called as vagus nerve. Next question is which part of the conduction system has the slowest conduction velocity? And the options are SA node, B. AV node, C. Bundle of His, D. Purkinje fibers, E. Right atrium. And the answer is slowest conduction velocity is seen in AV node of heart. Why AV node is slowest to conduct? Because it has got less number of gap junctions between the cardiac cells. Please mind it, AV node is a modified cardiac tissue, and at the internucleated disc here, the gap junction number is less. So that's why the signal conduction will be slow at this point, and this has slowest conduction velocity. So if you are asked in examination which component of the cardiac conduction system is fastest to conduct, then the answer will be Purkinje fibers, because in Purkinje fibers between the cells there are highest number of gap junctions present. Next question is the period of isovolumetric contraction occurs when A. All valves are closed and pressure is rising. B. Ventricles are filling with blood. C. Atrial systole occurs. D. Mitral valve is open. E. Blood is being ejected into arteries. So this question is about cardiac cycle. So if you know the cardiac cycle, systole and diastole and their subphases, then you will be able to answer this question. Isovolumetric contraction is the very first subphase of systole. The answer for this is all valves are closed and pressure is rising. Because this is isovolumic or isovolumetric phase, so it means in this case the volume will remain the same. And the volume is actually end-diastolic volume, which is about 130 ml. So that's why all the valves will be closed. So the mitral valve and the aortic valve, they will be closed. So no blood will be entering into the ventricle, no blood will be leaving. So that's why volume will remain the same. But the pressure will be rising in the left ventricle because pressure from about 0 millimeter of mercury, it will be going up to about 80 millimeter of mercury in the left ventricle. Next question is, which heart sound is associated with the closure of AV valve? And the options are first heart sound S1, B second heart sound, C third heart sound, D fourth heart sound, E murmur. And the answer is the heart sound which is associated with the closure of AV valve is first heart sound. Please mind it when the AV valves are closed at that time, first heart sound is produced. This is at the start of systole. And the second heart sound is produced when the semilunar valves are closed, and that's at the start of diastole. Next question is QRS complex represents options are atrial depolarization, B ventricular depolarization, C ventricular repolarization, D AC nodal activity, E AV nodal activity. And the answer is QRS complex represents ventricular depolarization. So you should know in ECG what does represent P wave. So P wave represents atrial depolarization. QRS complex represents ventricular depolarization. And the T wave represents ventricular repolarization. Next question is, what is the normal PR interval duration in an ECG? And the options are A 0.12 to 0.20 seconds, B is zero point 0.2 to zero point 0.3 seconds, C zero point 0.3 to zero point 0.4 seconds, D zero point 0.4 to zero point 0.5 seconds, E zero point 0.5 to zero point 0.6 seconds. And the answer is normal duration of PR interval is 0.12 to zero point 0.20 seconds. This is very important to know this the PR interval. PR interval is from the start of P wave to the start of R wave or Q wave in ECG. And if this duration is more than 0.20 seconds, this is usually because of AV nodal blocks. And AV nodal blocks occur when there is too much delay of impulse at the level of AV node and AV bundle. Next question is an exercise stress test to rule out ischemic heart disease. Angina pectoris is positive if A. Systolic blood pressure rises, B. ST segment of ECG is depressed, C. Heart rate fails to increase, D. A diastolic murmur is heard, E. The diastolic blood pressure decreases. And the answer is angina pectoris will be seen in case of excess stress test if ST segment of ECG is depressed. So this ST segment is very important in ECG. If ST segment is elevated, this is usually because of myocardial infarction. And if ST segment is depressed, so this is usually because of angina pectoris. In angina pectoris, there is partial occlusion of the coronary artery. And in case of myocardial infarction, there is complete occlusion of the coronary artery. Myocardial infarction is also called as heart attack. Next question is functional syncytium is seen in options are cardiac muscle, B smooth muscle of the unitary type, C skeletal muscle, D both in cardiac and unitary smooth muscle, E both in skeletal and smooth muscle. And the answer is both in cardiac and unitary smooth muscles. Functional syncytium means the cells in a tissue behave as a functional unit. So this is seen in case of cardiac muscle and the unitary type of smooth muscles because they have gap junctions in them. And because of presence of gap junctions, if one part of the cardiac muscle will be excited, the signal will rapidly spread to the other cells as well. And in this way, whole of the muscle will be excited all at once, making it a functional unit or functional syncytium. Next question is the hormone that is produced from the atrium of heart in case of fluid overload situation is options are A somatostatin, B glucagon, C ANP, D epinephrine, E norepinephrine. And the answer is the hormone secreted from the right atrium of heart because of fluid overload situation is ANP, which is also called as atrial natriuretic peptide. So this hormone is called atrial because it's produced from the atrium of heart. Natriuretic because this hormone is responsible for loss of sodium and water in urine. Why this is a peptide? Because a protein hormone. This hormone is produced when we have too much fluid in our body, and this hormone will cause loss of sodium and water in urine. Hence, by negative feedback, it will tend to decrease the fluid volume in our body. Next question is Frank's Stalling law states A. Greater the heart rate, the higher the blood pressure. B. The amount of stress the ventricle is subject to affects the force of contraction. C. The volume of afterload affects the force of ventricular contraction. D. Cardiac output equals stroke volume times heart rate. E. The greater the resistance, greater the blood pressure. And the answer is, according to Frank's Stalling mechanism, the amount of stress the ventricle is subject to affects the force of contraction. This means that if more blood is filled into the heart, which means more is the end diastolic volume or preload, more will be the force of contraction. So, cardiac output is directly proportional to venous return. This law is called as Frank-Stalling law. This law is not only applicable on cardiac muscle, but this is also applicable on skeletal muscles because both of these muscles have got sarcomeres. But this law is not applicable on smooth muscle because sarcomere is absent in smooth muscles. So, according to this law, we can say that cardiac output is directly proportional to venous return. If more blood returns to heart, more will be preload or end diastolic volume, hence more blood will be pumped out of heart, but within physiological limits. What is the normal duration of cardiac cycle at a resting heart rate of 75 beats per minute? And the options are A 0.8 seconds, B, zero point 0.6 seconds, C, 1.0 seconds, D, 1.2 seconds, E, it's variable. And the answer is normal duration of cardiac cycle when your heart rate is 75 is 0.8 seconds. And how do we calculate it? Heart rate is equal to 60 divided by duration of the one cardiac cycle. What is the 60? 60 is 60 seconds in 1 minute. The duration of one cardiac cycle is equal to 60 divided by heart rate. In this case, heart rate was 75, so 60 divided by 75 answer is 0 0.8 seconds. 0 0.8 seconds. So this is the duration of one cardiac cycle in this case. Next question is, during the period of ejection, the left ventricular pressure reaches a high point of approximately, and the options are 20 millimeter of mercury, B 60, C 80, D 100, E 120. So the answer is 120 millimeter of mercury. So this is the maximum pressure which occurs in left ventricle during rapid ejection phase. Next question is, which of the following phase of cardiac cycle is last phase of ventricular diastole and is responsible for about 20% ventricular filling? And the options are A. Isovolumetric relaxation, B. Atrial systole, C. Diastasis, D. Ventricular ejection, E. Isovolumic contraction. And the answer is atrial systole. The last phase of ventricular diastole is the contraction of atrium, also called as atrial systole. This is responsible for 20% filling of the blood in ventricle. So it means that rest of 80% filling in ventricle is passive filling, which occurs during rapid filling phase and the slow filling phase. Next question is end diastolic volume is the options are the amount of blood in the ventricle at the end of systole, B, the portion of end diastolic volume that is pumped out during one systole, C, the volume of blood pumped out of heart with each beat, D, 50 ml at rest, E, 130 ml at rest. And the answer is end diastolic volume is 130 ml at rest. So this is the volume of blood which is filled in the ventricle at the end of diastole, 130 ml at rest. Actually, 50 ml is the volume of blood which is at the end of systole, which we call as end systolic volume. And the difference between these two is called as stroke volume, which is about 80 ml. Next question is, what is the term for the volume of blood ejected by each ventricle per beat? Options are end diastolic volume, B, end systolic volume, C, stroke volume, D, cardiac output, E, ejection fraction. And the answer for this is stroke volume. So the volume of blood ejected by each ventricle per beat is called as stroke volume. Its resting value is about 70 to 80 ml per beat. This is the difference between end systolic volume and end diastolic volume. Next question is, which of the following terms that describe blood volume ejected from left ventricle of the heart per minute? And the options are cardiac output, B, ejection fraction, C, stroke volume, D, preload, E, conductance. And the answer is cardiac output. Cardiac output of our left ventricle and also of the right ventricle is the same, and its value is about 5 to 5.5 liters per minute at rest. Please mind it, the volume which is pumped out of each ventricle per beat is called stroke volume, and the volume which is pumped out of each ventricle per minute is called as cardiac output. Formula for cardiac output is stroke volume into heart rate. Next question is, Joe's cardiac output at rest is 5 liters per minute. When he is exercising strenuously, it is 20 liters per minute. What is the value of Joe's cardiac reserve? And the options are 600%, B 500%, C 400%, D 300%, E 200%. The answer is 300%. And how do we calculate cardiac reserve? We calculate the difference between resting cardiac output and the cardiac output at the time of strenuous exercise. So the difference between 20 and 5 is 15. So cardiac reserve formula is equal to increase in cardiac output divided by resting cardiac output. So increase in cardiac output in this case is the difference between 20 and 5, which is 15, divided by the resting cardiac output, which is 5. Answer is 3. In order to get cardiac reserve in percentage, we multiply it with 100, which will be 300% in this case. So it means that this person who is having cardiac output of 5 liters per minute at resting time can have a maximum cardiac output of 20 liters per minute when he will be exercising strenuously, and his cardiac reserve is 300%. Cardiac reserve for athletes can be about 500 to 600%, and cardiac reserve is decreased in old age. It can be just 200% or 300%. And the cardiac reserve in case of cardiac failure can be decreased to 0%. Next question is which of the following is not a type of circulatory shock? Options are hypertensive shock, cardiogenic shock, hypovolemic shock, anaphylactic shock, septic shock. And the answer is hypertensive shock is not a type of circulatory shock. All other cardiogenic, hypovolemic, anaphylactic, and septic are the types of circulatory shock. Next question is anaphylactic shock is triggered by options are blood loss, severe allergic reaction, heart failure, infection, dehydration. And the answer is anaphylactic shock is triggered by severe allergic reaction. Actually, anaphylactic shock or anaphylaxis is systemic allergy. That's the generalized allergy for whole the body, in which case the basophils and mast cells release histamine throughout the body, which causes dilation of the blood vessels, blood pressure decreases, there is increase in capillary permeability, so there will be itching everywhere in the body, and also decrease in blood pressure and difficulty in breathing. This can occur in case a person is allergic to penicillin or some other antibiotic. If the injection of that antibiotic is given, the person may develop a systemic allergic reaction, which is called as anaphylactic shock. It can be fatal if not treated. So, what do you think? Which type of shock occurs when infection spreads everywhere in the body? That type of shock, which is because of infection in the body, is called as septic shock. Which type of shock occurs if there is dehydration in a person because of diarrhea or vomiting, or the person is not drinking enough water? That type of shock will be hypovolemic shock. Which type of shock occurs in a person who is having some issue with the heart, for example, valvular failure? The type of shock will be cardiogenic shock. Next question is identify the false statement about circulatory shock. A. Hypovolemic shock is associated with low cardiac output. B. Septic shock is associated with cold, clammy skin. C. Cardiogenic shock is associated with arrhythmia, myocardial infarction, and myocarditis. D. Obstructive shock is associated with cardiac tamponade and pulmonary emboli. E. A high dose of general anesthesia may cause anaphylactic shock. You have to identify the false statements. So it means four of these five statements are correct. Identify the false statement. That will be the answer. And the answer is septic shock is associated with cold, clammy skin. Please mind it, in most of the types of shock, our skin is cold because of sympathetic stimulation. But in case of septic shock, there is fever in the body. So that's why there is warm skin in case of septic shock. It's not cold. So that's all for today. Soon we will discuss MCQs from blood physiology. Like, share, and subscribe. Thank you.